the number of new cases that they have is relatively small. But they would have hoped that because they're about 70%, things would have started to really die down. But this Delta virus changes the equation. So there's hand washing, physical distance, and face masks. And then there's the vaccine. And those things are helping positive. But what is trying to turn that back a little bit is the nature of the virus itself. Now, there's a new Lambda virus coming out of Peru because Peru has been swamped.
Just a second, caller.
With virus, and that mutation taking place. Studies have shown in patients who are cancer and so forth, who are the virus persisted for a long time, and even whilst they were in the hospital, the virus changed in the hospital. Changed and mutated whilst in the hospital. Why is this? That category of virus, category 5 of viruses, the RNA viruses, what we call a positive sense. What do? They mutate.
Okay.
They love to mutate. HIV is one of them. Has no relation to COVID, but it's in that category. I was on the team that had the first case of HIV-2 in the United States. You understand? So, and we have different strains of HIV because it's an RNA virus that always tends to mutate. These mutations we're seeing with Delta and Lambda is unfortunate, but the only way is if we vaccinate, we will tend to swamp it and prevent it from getting.
Okay. Good morning, caller. Apologies for the long wait. Good morning. Welcome.
Good morning, QG, Crystal. Good morning, Dr. Thompson. Good morning, Phyllis and Granny. This is Annesia.
Anesia.
Morning.
Sorry for the hold up,
Anesia.
Anesia.
That's okay. I know the work. I know you don't even have a lot of time left. So I hope I would be given due opportunity to answer all these lies that Dr. Thompson has told about me, the Tuesday Seventh-day Adventist Church, and so many hundreds
Probably
of
not
scientists
all.
around the world.
Probably not all with the time that we have
Maybe
remaining,
like a
but maybe you
5
can pull
minutes.
up.
In
Maybe you
other-
can
in
pull
other-
up.
in other words-
I don't mean no at all. That's
Oh,
all
okay,
I'm
good.
saying,
So
because
pull
I
out
know you don't have a lot of time.
Pull out the main ones.
Right?
Pull out the main ones,
The
1
main
and 2.
thing-
Let's
First of
go.
all, let me just correct 2 things that Crystal said. And I posted the links for persons in the comment section to see, because I always like people to go and do their own research. They don't have to take my word for it. The reference I made to dandelion yesterday comes from a study that was done by German researchers. So it's not no word of mouth thing. It's not anybody just making up something. German researchers, and I sent you the link yesterday, Crystal, they're the ones who came out in a study and said that they had found that dandelion could block the spike protein from attaching to the ACE2 receptors in the body. So anybody could go and check out that study and see what they're saying about dandelion. Second thing is, I was not the one who said that the vaccine stays in the arm. I was referring to statements from Dr. Birdle out of Canada, who is a vaccine researcher, and he had come out and said that they made a big mistake. They thought that the spike protein would stay in the arm, but they realized through a biodistribution study that Pfizer had for the Japanese, given to the Japanese, and the Japanese, through a freedom of information request made by these researchers, they got access to the biodistribution study, and it showed that Pfizer knew, and Pfizer knows, that the spike protein from their vaccine does not stay there. It gets distributed throughout the blood, and it gets into certain organs, including the ovaries, the spleen, and so on. All of that can be seen in an article called Vaccine Researcher Admits Big Mistake, Says Spike Protein is Dangerous Toxin. It was published on May the 31st, and it has all the quotations from Professor Brian Birdle out of the University of Guelph. So that was something that originated with me. That's the second thing I
Thanks
want
for
to
the
make
clarification.
clear. No problem, my
Yes.
dear. The third thing is, here we have Dr. Thompson making a lot of claims about colloidal silver, ivermectin, and hydroxychloroquine and things. Again, I want people to go and check for themselves. You don't have to take my word for it. No, Dr. Thompson doesn't have a monopoly on science, neither do I. You go and check for yourself. Check the frontline critical.
But I think in addressing
COVID-19 critical care
in addressing the
alliance site.
in addressing 2 of the drugs, there are a number of articles that he presented to basically, I mean, likewise you did as well, but
yes,
I
but
think
listen to me, Fuji. He has lied a lot, and I'll say how. Right? For example, he gives the impression that what I reported yesterday when I spoke about the Jamaican doctors, he gives the impression that that was their position until this big study he claims came out saying ivermectin doesn't work. This is not true. By the way, let me just refer to the doctors who I was referring to and tell you who they are, because he's an
I
infectious
heard them. I heard them.
No,
I heard
you
the
didn't hear them. I
doctors.
didn't call them before. Let me call them for the first time. Professor Brendan Bain, consultant physician and infectious disease specialist. This is out of Jamaica. So he's not the only infectious disease specialist talking about ivermectin. I'm quoting the doctors for you who lobbied the government of Jamaica to bring in ivermectin.
Early
because
this
it
year.
works.
Early this
Hold
year.
on. Let me finish. Professor Brendan Bain, consultant physician and infectious disease specialist. Dr. Hafizul Muhammad, consultant physician and cardiologist. Dr. Michael Banbury, Chief Executive Officer, Medical Associates Hospital and Medical Center. Dr. Neville Ballin, consultant anesthesiast and pain specialist. Dr. Michael Abrahams, consultant obstetrician and gynecologist. Dr. Garth Rattray, family practitioner. Dr. Alfred Dowes, consultant surgeon, and Dr. Charles Royce, consultant surgeon. These 8 doctors signed a letter lobbying their
But
government.
the
Alright?
lobbying of the government was when.
This was in May, okay, but let me say what is the update, right? This was in May, and one of the things they said, and I quote just a little 2 sentences from the letter at the bottom before they signed. They said, whether or not the Ministry of Health chooses to include ivermectin, in its approved protocol for the management of COVID, we call for it to be allowed to be import adequate quantities for widespread distribution at best prices for use in public and private sectors under doctor's prescription and supervision. And they also said this concerning the WHO, because a lot of people call it WHO. They say we need not await WHO approval of the use of ivermectin for treatment of COVID-19. The WHO, unfortunately, these are what these Jamaican doctors are saying, the WHO unfortunately has been slow and sometimes incorrect in its assessment and advice on various aspects of the pandemic, and specifically so in relation to its current stance on ivermectin. Now, the Jamaica government, and I'm quoting for you now what happened, what was reported in the Jamaican Observer on July the 26th. Okay? The Minister of Health, Thompson, he came out and he said, ivermectin will be imported, but not for use in the public sector fight against COVID. But hear what he said, which we don't have that option here in St. Vincent. Hear what he said, at least reported in the Jamaica Observer 26th of July. That's just the other day. So you want to talk about big study out of Egypt saying ivermectin don't work? This is what the Jamaica government has decided for their people, and I quote from the article. While it is not being offered in the public healthcare system, Thompson said, that's the Minister of Health in Jamaica, Thompson said doctors and patients can decide how they choose to use it. This is the option we don't have. While CUA vaccine, as they call it, that hasn't been proven to have long-term safety or efficacy results, is being forced down our nurses and other frontline throats through mandatory work that is going to happen here in the legislature today. I am saying that is wrong, because you have doctors like these 8 in Jamaica who lobbied their government despite that big study he referred to. And by the way, you're talking about one study. Let me tell you the stats on ivermectin studies right now, which people can find on the FLCCCA site. 60 trials with 573 scientists, 21,825 patients, an additional 30 randomized control trials. Let me give you 2 pieces of the results of all that 90 trials there. 85% improvement shown in 13 prophylaxis trials. That is trials to show it could work to prevent you from actually getting the COVID if you take it in a prophylaxis way. 74% improvement in 26 early treatment trials, etc. I can't go through all details now, but if you want the FLC, you will see the results, you will see the graphs, this to me, you will see the actual graphs from different places in India. You will see graphs from places in Brazil. You will see from Paraguay. You will see from Slovakia, from Peru, from Argentina, from Mexico, of different results of studies they've had showing the ivermectin, when used, caused cases to decrease dramatically, as well as death. The death rate decreased dramatically. Dr. Thompson cannot speak as if he could speak his opinions. He cannot speak as if these hundreds of scientists and thousands of patients who the ivermectin have been used on are not real, and that it doesn't exist, that the same has been working in people. The same thing was done with hydroxychloroquine. He lied on it. Why doesn't he tell the country that when the Lancet published a big hydroxychloroquine study, they claimed that hydroxychloroquine was bad for the heart? When over 700 doctors appealed to them to say, show us the data for the study because we've been using hydroxychloroquine and zinc, especially in early treatment with success. Show us the data that you base your publishing on. What did the Lancet do? When they checked with Surgeons Fair, the company who gave them the data, they couldn't get the raw data as they should, the details. So what they did, they retracted the study. It's on their site. So you want to talk about retracting a study? Tell the people that the Lancet had to retract a study, okay, showing the hydroxychloroquine was bad because it wasn't true. So he is not the only one who has evidence of studies that were retracted. And what should be allowed in the country is for people to have this freedom. And he must also tell the country if he supports our heroes of frontline nurses, doctors, and policemen.
I support them.
Put
You
out of a
bet
job
I support them.
because they
You
don't want
bet.
to take a certain
You bet I
thing
want to
there.
protect
He
them.
must tell the country
Yes,
that.
All right.
I bet I want
Thank
to
you.
protect them.
Thank you,
very
Annesia.
much. Thank you, Annesia.
Thank you,
Another time I
Annesia.
will deal with all your other lies about
Yeah,
colloidal
man.
silver.
Yeah,
and
God.
lies on
And
Tuesday
promote
and
colloidal
Wednesday
silver.
because
Get
you
a-
lied on Tuesday and
Yeah,
Wednesday.
make a dollar. Make a dollar. Make a dollar.
No. We're not going there.
When you say they can't take it because they will get in trouble, that is a lie.
Man, you
Dr.
could
Thompson.
make it
Okay,
dollar.
thank you,
could
thank
take
you,
it.
Annesia.
Could
Thank
take
you,
it.
Annesia.
Listen.
Anything
Fuji-
that you want to go in
Fuji,
on
quickly.
except addressing the Thusians.
Yes,
and
I
the
got it.
colloidal silver.
Listen, I just want to say, Jamaica has over 1,000 doctors. Whether 8 doctors earlier on this year said so. Even I was warming towards ivermectin. The new information has finally come out after retractions in the same journal showing it does not work. People who are listening, don't be fooled because Annesia wants ivermectin approved or hydroxychloroquine, Donald Trump's drug. God, lad, man, come on. You know, and she quotes American doctors. Everybody look up American doctors online. This is Nicole so-and-so or Simone Gold who stormed the Capitol trying to make money. That's all this is. Now, one caller said that doesn't matter. If Pfizer make money, they could make money too. I may agree with that. But what I want to end up with is that we are in a global pandemic. One of the things Annesia was trying to play down, this virus isn't really so bad. They're inflating the amount of deaths. Let me tell you something. You go to the website in India, Turkey, Russia, Brazil, they're not all knocking, the leaders, they're knocking glass and coming together and say, let's do something, a conspiracy to fool people and elevate the amount of deaths. People are dying. You asked the question about India. People were dying in India. And in the BVI, they're fooling people in BVI. Those 89 people in St. Lucia, they the 1,023 in Trinidad. Now, Trinidad, they went 2-3 weeks ago and they banned ivermectin and hydroxychloroquine use. She's citing Jamaica. Closer to home, Trinidad 2-3 weeks ago said no. And other entities, because of the information, I didn't point out one study, 2, 3, 4, I brought about 7 or 8. And there were more. Because that's what flooding the market. You got to read. You can't take an article from 2020 and then use it and not realize that 6-7 months have passed, 8-9 months have
Without
passed,
new
and things have
information.
changed. There's new information. You all asked for some good questions yesterday, challenging her. The virus is real. And I want to end with saying this, that 90% plus will be protected. That's 7, 8, 9, 10%. They're not going to be fully protected. It's not 100%, but 100%. If it's not 100%, doesn't mean it's 0. And those other individuals would get it in a milder way. I'm not absolutely going to say that there won't be, and I go back on that, there won't be any hospitalization because a lot of these people have other comorbidities. Some of them have diabetes that will go under control, other things like that. And the admission is a judgment thing based on the doctor. I wouldn't just say, well, because you're vaccinated, we ain't admitting you at all. I might admit because I want to make sure and monitor the situation and have them in isolation and so forth. However, in terms of severe disease, we're not seeing it, Now, in terms of the Delta virus is worse. Whether you want Delta plus, I'm not so worried about that. I'm saying that what we're doing at our borders has been protecting us. what Dr. Duncan and Simone Keys, what they've been doing at the airport and so forth, they have protected us because they have that quarantine system. And there's a lot of pressure.
Would you agree? Are you in agreement with mass mandatory vaccination? Should that be?
Now,
is that do you
what
think
they're
that
doing?
that is
What they're doing in
the
Parliament?
direction?
What they're doing in Parliament is they say they're not doing mandatory vaccination. Everybody, they're talking about
Not
some
for everybody, but for some.
For everybody.
some frontline. No, not everybody. Some frontline workers who are likely to be interacting with patients around the world. One of the most professions that people have died has been in the healthcare sector. Because that's where the HIV patients have to go. And even though you have on a mask and PPEs and you wash hands.
COVID patients.
COVID patients, yeah, sorry. I make a correction. COVID patients, thank you, Crystal. And because of that, they're at risk. But at the same time, healthcare workers could be also a risk to their own families. And they could also catch it in their casual time and bring it into patients who are already in the hospital. Who think. So there is this process of around the world, whether France, United States, New York, you are seeing the same thing. Healthcare workers are being asked to vaccinate. There's a high level, a lot of hesitancy among that particular group. But I am hoping that they will follow the lines. This thing is not about mandatory vaccination of the whole population. They're exaggerating in relation to that.
It's not mass mandatory
No,
vaccination.
it's not mass
it's not.
mandatory vaccination. It is the front line. A policeman goes into a crowd and so forth, and if he's positive, he's likely, if he has to arrest or touch people or so forth,
Okay.
this thing.
Okay.
All right.
All right. Good.
All right, I
Would
think
you-
that's it. We are well over time. Thank you so much for the
Yes.
equator, Dr. Thompson. Thank you so much for stepping in and answering, refuting some of the
Well,
claims.
I'm always willing to come back if Annesia comes back and she starts to.
Oh,
to put,
Lord.
I basically we do a
Well,
ding dong,
well,
a ding dong sort of thing.
And
guess what?
declared that she will be back.
And guess
yesterday.
what? And guess what? I will see. I want to say a few things, but she took up a little bit of the time, and that's right. That's okay. So I would want to call in if
When she's-
Annesia comes back,
yeah,
and we'll
yeah,
see.
yeah.
That'd be nice and so
Yeah,
forth.
yeah.
At
All
the
right.
time, I'll call in later. So I want to thank all the listeners, and it's certainly my pleasure, Fuji. And Crystal,
Yeah, it's a
it's
pleasure
always been a
having you,
pleasure.
yes.
And if in any way
Likewise.
I have been offensive and so forth, I didn't really mean that.
I didn't get that.
It's not my personality.
I didn't get that. I didn't get that.
Yeah.
It's all right. It's Thursday drama.
Thanks,
We
Doc.
allow
Thanks
this
for
on a
bringing
Thursday.
the drama as well.
We allow
Listen,
it
guys.
on a Thursday.
Oh, we
All
allow
right?
anything on a Thursday. Thank you so much for joining the wake up call this morning. Thank you for your calls, WhatsApp messages,